Making sure they understand their follow-up, right? Because a lot of patients, you'll be like, do you understand? They're like, uh-huh. And they don't have a clue. So making sure that they actually understand what was explained to them.
Let's talk about how employers can and do sometimes play games with this. And we're going to walk you through the three different types of models. The analysis or the takeaway is kind of the same on all of them. You're likely going to be paid on a work RVU model or a collection model or a gross charges or a billings model, right? They're sometimes framed differently, but it's the same concept.
I am a rural full scope family physician. I practice in Northern California, and I left insurance-driven medicine in 2021 to open our Big Trees MD DPC.
PBMs are just destroying our healthcare system. They're just making money hand over fist, and they're just middlemen. They're just moving money around and keeping half of it.
After the consult, the patient and the referring physician receive a detailed written report that includes clinical reasoning, differential diagnoses, specific recommendations, and information about what's recommended to do next.
Going into practice for yourself is a big old unknown, and that is scary. But I think kind of remembering like, hey, there's like an innate part of me and training that is going to make this concept difficult for me. And then if you name it, you can kind of move past it.
These high fidelity mannequins are ultrasoundable. They can ultrasound them and shows an image on a screen of what you as the person developing the clinical case wants the students to see.
There's multiple studies that show that patients who are more engaged in partnership with our physicians in developing a treatment plan, they're more adherent to medical advice and treatment plans. And then they have, as I mentioned earlier, half the mortality rate of less adherent patients.
The second largest lobby in Washington is healthcare. And before you get all self-righteous about it, the American Medical Association contributes to that.
Naturally, I had more entrepreneurial business mind. I wanted to try a lot of things, but I couldn't try things because that wasn't in the best interest of the organization. That couldn't be replicated amongst other clinics.
Because one of the great mistakes is to judge policies and programs by their intentions rather than the results. And you really have to look at what results are objectively, honestly, because as we all know, the road to perdition is paved with good intentions.
Now we have a more workable number than just trying to attack 479,000 responses and figuring out how are we going to influence these things that are affecting them and then reducing costs.
I also started to advocate for others, and when I did, that just wasn't encouraged. And I would get my hand slapped, and it just kind of became seen as uncooperative. And so soon enough, that just felt like my values weren't aligned. I didn't feel like I was being supported.
So we are going to take a little bit of a deeper dive into social media and how we promote ourselves, again, with understanding that concept that social media provides us with a digital solution to increase our visibility and having people find us and recognize us as the expert.